Okay, so here in week 9, we are going to be talking about the adolescent. We are also going to be talking some about pediatric trauma. So over the last few weeks, we have seen the progression of your patient from infancy through their school age. So this week, we are going to be covering them as they reach their adolescence and as they try to figure out who in the heck they are. So, as an adolescent, the patient is seeking their independence. As I said, they're trying to figure out who they are. Being in between childhood and adulthood is a difficult place to be. You are not really old enough to do this thing, but you're too old to be doing that thing. So that can be very confusing and very frustrating for the adolescent. Nurses who work in pediatrics will deal with this age group for various reasons, but you will come in contact with them. So definitely this age group is something that you definitely would want to have a good understanding of. As far as the nursing care goes, it's still family centered, though the patient can provide more input because they're older and they can have a little more of the decision making capability than your younger patient would have. Parents may not stay with the child overnight while they're in the hospital once they reach adolescence. They may not think they need to have their parent there. Parents will still be working and they may come when they get off of work. They'll call during the day. This is a very common scenario for an adolescent when they're hospitalized. Nursing care is still tailored toward that patient. They're not little adults. That is the mistake that a lot of nurses make, is that they treat the adolescent as if they are a little adult. They aren't. They're still a kid, and they still have very specific needs from us. They need a lot of support and encouragement. Keep them involved in every phase of their care. That really helps to make them feel like what they think matters, because that's very important to an adolescent. They want to be heard. They want to know that what they think matters and has significance. Even though they want to be seen as an adult, they still want reassurance that their family cares about them. Even though they may say things like, yeah, my mom, she's kind of a weirdo, or my dad is this, and, but underneath it all, they still want to know that their family loves them and that their family cares about them and that their family wants to be part of their life. Okay, so for the next few slides, we're going to talk about some common issues that face the adolescent population. So acne, that is a dreaded part of adolescence. It affects them individually. Not everyone is hit the same. So some can have it more intensely. They have very significant breakouts. They may end up with infections even from those pimples. They may end up with scars on their face from those pimples. And then others have hardly any at all. They might get one every month. Maybe a girl during her menses, she may end up with one, but other than that, she really isn't bothered by it. It seems like it should be worse for girls, but boys care about their looks just as much. So it can cause damage to their self-image, whether they're a boy or a girl, because really, what do boys want? Boys want to be able to be involved with girls. So if they have a lot of acne, maybe they won't be as attractive to the girls as they would be if they didn't have any. So that's kind of where their self-esteem can be centered when you're talking about their looks. We perceive a person by what we see on the outside. This is my own personal quote, because that's the first thing that we see is the outward appearance. And when you see somebody that has significant acne on their face, it can be off-putting sometimes. Or you might think that they are not especially clean about themselves. That's a definite misnomer as far as acne is concerned. It doesn't have that much to do with their cleanliness or their hygiene. It can, but it's something more significant than that. It can cause havoc and emotional upheaval. These kids require a lot of support from their caregivers because they know what they look like and they are constantly concerned about what everyone thinks of them. You have to remember that during adolescence, they have the raging hormones, but they're constantly concerned about what others think about them. Okay, next up, weight. Girls or boys, doesn't matter. they're going to be focused on their weight. Physical appearance is crucial during this stage of growth and development. What they look like is very, very important. Overweight kids may tend to be more shy and withdrawn. They try not to be noticed. These are your wallflowers. They feel awkward, they feel unattractive, and so they try not to draw any attention to themselves. But the opposite could be true. Sometimes they're more gregarious. They're kind of the goofball or the funny guy. They make jokes, self-disparaging jokes, because they think that that's going to be a way for them to be more accepted. They give the impression that they're confident, but likely they are self-deprecating and self-loathing. They really don't like themselves very much because they don't think anyone else likes them. Or how could anybody like me because I'm overweight, because I'm a fat kid? And how could anybody like me? I mean, look at me. I'm very unattractive. Remember, kids can be the meanest people on earth, and words do hurt. And as I talked about in class, I know this from personal experience. Okay, peer pressure. We all know what that is. It's ominous and it's very influential. With this particular age group, peer pressure can be more significant. It has a more significant impact on what the adolescent will do. The peer group is the most important aspect to the adolescent. They're the center of their world in most cases. What their peer group thinks of them and what their peer group thinks of everyone else is very, very, very important. Adolescence is a time of discovery and learning about who they are as people, as I said in the beginning. This is a powerful motivator to experiment. This is where the risk-taking behavior begins to manifest, and it manifests through that peer pressure. Drive really fast down a country road and play chicken with some of your other school friends. This is where they do stupid things. Dive off a bridge on a dare. So as it says here on the PowerPoint, I did take care of a patient many, many, many years ago that had a spinal cord injury who dived off of a bridge in his town to impress a girl, and it left him a quadriplegic. So you just have to keep in mind when you're working with this population that they don't always think things through. They do a lot of dumb things, and they do them without thinking about the consequences. They're very immediate and very impulsive. That's probably one of the most important things to remember when you're dealing with an adolescent as their caregiver. They can be extremely impulsive. Okay, so sex, as we've covered in some of our discussion material, and as we've briefly touched on in class, adolescents are naturally curious, but they can also be reckless when it comes to sexual activity. It's not going to happen to me. That's a very common phrase that I've heard over the years from the adolescent population. Nurses have to educate both the child and the family about safe sex practices. Now, this would probably take place more often in the office or clinic setting where there's more time. The hospital is a more acute setting. There's more serious things happening, so you probably aren't going to be able to take as much time to talk to them about safe sex practices unless the reason that they're being seen or the reason that they're being hospitalized is because of maybe a sexually transmitted infection. Parents need to be willing to have those open conversations, and this is kind of where we can come into play. We can support the parents, we can encourage them. This is a very important part of growing up, and the kids really need to be able to have open conversations with you, because if they don't think that you're going to be accepting and supportive, they're not going to tell you about that side of their life because they're going to be afraid of being in trouble or afraid of being judged. This is a very touchy subject. Sometimes parents don't want to know, kids don't want to say. So if you're in a situation where you are dealing with an adolescent or a school-age kid for that matter, because they can become sexually active when they're in school, when they're the school-age group as well. If you get the sense that this is a touchy subject for the child, don't discuss it in front of their parents if it makes the patient uncomfortable. You know, because then you're going to lose some of that trust that you need to establish in order for them to trust you as their caregiver. Remember that we have to establish a rapport. But if you're doing things that make them uncomfortable, or you're talking about subjects with their parents that they would rather you didn't, that's going to affect that rapport that you're trying to build. Okay, so moving on, psychosocial issues. This is a very important part of adolescence and it affects them all in different ways. But the most significant part of the psychosocial issue is the suicide rate. Suicide rates vary depending on the ethnic group. And according to what I found on the CDC's website, rates for males age 15 to 19 increased from 12 to 18 per 100,000 from 1975 to 1990. Now that seems like it's a long time ago, but as you can see, it declined to 10.8 in 2007, but then it increased by 31% to 14 in 2015. So what's the reason for that? A lot of the reason for that is the increasing rates of depression. These kids are depressed. They may not show it on the outside, but on the inside, they're very depressed. And we have to be able to pick up on those subtle non-verbal cues and in turn educate their families about those subtle non-verbal cues because sometimes parents are oblivious to the fact that their kid is depressed. Oh, well, he seems normal. I mean, he's been going to school and he's involved in all these activities and he has all these friends. I hear that. I've heard that over and over again over the last 30 years. And that's not always true. That might just be surface. That might just be the outside appearance. Rates for females can be lower, but they're still significant. So for ages 15 to 19, 2.9 to 3.7 per 100,000, and that's between 1975 and 2007. But then it increased between 2007 to 2015 to 5.1. Now this is the bottom of the PowerPoint there. That's the website where I got this information. If you're interested in that and you want more information about it, just go on that website there and use that information at the bottom there to be able to access this same information that I'm giving you. So as I said, increasing rates of depression in the adolescent population are definitely contributing factors, but also more and more of the adolescent population is being diagnosed with these serious mental illnesses, things like bipolar disease and schizophrenia. My youngest brother was diagnosed as a schizophrenic when he was 16 years old. And schizophrenia will manifest itself in the later adolescent age, but it can happen earlier. A lot of times it's a traumatic event that will cause it to be triggered, and that then all of a sudden those symptoms that they've had really come to the surface. And for my brother, when my father died, he was 16 years old, and that is what manifested the symptoms. After that event occurred, it was pretty much all downhill from there. He started having issues with drugs and with drinking and with, getting into fights and all of that. Major depression, that's another one that is pretty common in the adolescent population. All of these problems can affect the adolescent population to a certain degree, but not necessarily these specific mental illnesses. These are very specific categories of children. And some of the contributing factor, as you can see there, social media, cyberbullying. These kids can't get away from it. They have Facebook, they have Twitter, they have Instagram, all of these different social media vehicles, and they're constantly surrounded with it. And kids are not always careful with what they post on these sites. They say the meanest things, and nobody is immune from it. Nobody is. And so this is a big contributing factor to why these kids get depressed and then what eventually will lead them to suicide because they pretty much feel worthless. What's the point of living? I'm a worthless human being. You see what they say about me. Nobody likes me, they tolerate me or whatever. And it's very sad, really. But part of our role as the nurse caring for these kids is to pick up on that and to try to help and provide support wherever we can. Okay, so pediatric trauma. This we hear about a lot, whether in the news or maybe in our own neighborhoods, even in our own family sometimes. But it affects all age groups in childhood. No age group in childhood is isolated from a pediatric trauma. There's different reasons for trauma depending on the age of the child. So your infant population, they may end up with shaken baby because of their caregivers. Traumatic brain injuries or spinal cord injuries can be the result of shaken baby. Toddlers, they might get into a swimming pool if they're left unattended, or they might fall down the stairs and end up with a traumatic brain injury. Preschoolers, they might get a hold of their grandma's heart pills thinking that they're candy. That's a big mistake that parents make when they need to give their kids medicine, is they tell them it's candy. So that's part of the education that they need to be provided in the clinics every time they come in for a well child visit. Do not tell your kids that medicine is candy, because then as they grow, oh, here's a medicine bottle. Oh, remember mommy told me it was candy, and that's what happens. So they end up with accidental poisonings as a result. School age kids play with matches. They are obsessed with fire. And if they can get a hold of matches, they're going to light them up. So obviously that's one way that a house fire can happen. They want to impress their friends with dad's gun. Oh, look, my dad just bought this gun. Isn't it cool? Without realizing that it's loaded. And the next thing you know, they're firing it and they're ending up shooting their friend or shooting themselves. As we said earlier, adolescents are risk takers, partly because they feel invulnerable. It's not going to happen to me. Partly because they want to impress their peer group. Motor vehicle accidents are the #1 cause of death in the adolescent population, and suicide is quickly gaining. Being a risk taker means you do stupid stuff, like hold a firecracker in your hand after it's lit. Gee, aren't I impressive? Or drive your car at 100 miles per hour because you can. So pediatric trauma requires specialty training by the healthcare provider, okay? The child must be stabilized quickly or they will deteriorate quickly. Emergency departments need to be prepared at all times for the pediatric emergency because you never know when it's going to occur. Drownings, house fires, guns, drugs, motor vehicle accidents, head injuries from bike accidents, and the list goes on and on. Nurses who work with the pediatric population are all required to have PAL certification, which is a fancy word or acronym for Pediatric Advanced Life Support. So if you're going to work in the pediatric population, you are going to have that. Those nurses who work in the emergency room, they have to have that. Children have less reserve than the adult, especially young children and infants. And as I said earlier, they can deteriorate very, very quickly. Prioritization is crucial for a positive outcome when it's an emergency. And as I've discussed in clinical and some of the case studies that I've shared with you guys of my own personal experience from my own practice, they do deteriorate very quickly. So things need to be done quickly to stabilize them. And with your younger population, your infants especially, they're going to have respiratory problems most of the time before they're going to have heart problems. And eventually, as I've said before, when they're breathing so rapidly, if they're breathing 60 to 80 times a minute, they're going to get exhausted very quickly. And the next thing you know, they're not breathing because they're so fatigued. Okay, well, that's all I've got for you on this recording. So if you do have any questions, be sure to let me know. I'll see you in class. Thanks.